In case the patient rests to surgical treatments, some of them may undergo through robotic-assisted laparoscopic surgery, open surgery, or endoscopic surgery. The next disease is cystitis. Cystitis is the inflammation of the bladder. The cause of cystitis may be due to the reaction of some medicines, bacterial infection, using a catheter for a long time in case of some diseases, undetected underlying diseases, and the result of radiation therapy. Symptoms of cystitis include pain or difficulty when urinating, foul-smelling urine, pain or soreness of the abdomen, cloudy urine, and blood in the urine. In order to prevent cystitis, always empty the bladder fully when going to the toilet. Wear cotton underwear and avoid wearing tight jeans and trousers. We should avoid coffee, fruit juice, or spicy foods. We should have a shower rather than a bathtub to avoid exposing our genitals to the chemicals in our cleaning products for too long. Cystitis is normally treated with antibiotics for bacteria. The removal of contributing causes can also form part of treatment. The next disease is bladder cancer. When there is uncontrolled growth of cells present in the bladder, it is known as bladder cancer. The end result of this is a tumor in the bladder. The cause and effect in case of cancer is not yet very clear, but a number of reasons are cited for this purpose, and most of them are smoking, radiation, parasitic infection, and exposure to chemicals known as carcinogens. Symptoms of bladder cancer include pain while urinating, back pain, pain in the pelvic region, frequent urge for urination without actual flow or frequent urination, and blood in the urine. In order to prevent bladder cancer, avoid smoking or stop smoking if you are a consistent smoker. Exposure to some chemicals present in some materials such as rubber, dyes, textiles, plastics, leather tanning, and diesel fumes increases the risk of bladder cancer. Treatments for bladder cancer include intravesical therapy, radical cystectomy alone, or followed by chemotherapy. The next disease is urethritis. Urethritis is the inflammation of the visible genital part. The causes of urethritis are mostly sexually transmitted diseases, including gonorrhea or chlamydia. In order to avoid urethritis, avoid having intercourse with multiple partners. Use condoms every time you have sex. You should get tested regularly. Drink plenty of fluids and make sure to urinate shortly after intercourse. Avoid acidic foods. Also, avoid exposure to spermicides, particularly if you already know they irritate your urethra. Treatment for urethritis typically includes a course of either antibiotics or antiviral medication.
Created using Powtoon.